Hello everyone, and welcome to another episode of Ask Dr. Bob. And I want to apologize for the individual who asked me about a condition which was large M, small d, DS. I addressed another condition totally. This particular condition is about rocking and swaying. And then also when individuals maybe are on a boat ride, or they have their sea legs and they have this swing that constantly impacts their body, wanted to know what exactly is going on. So a couple things I want to share with you right now. I would have the cervical spine or neck checked. In our practice, we have a piece of equipment that we could literally do a video x-ray and look for the alignment of the upper neck region. We have found people with very severe chronic challenges, the vertebra in the upper part of their spine are literally quote-unquote stuck. Your brain stem actually goes to the upper part of your neck area. So if you have misalignment or subluxation there, it could create a variety of challenges. One of those are vertigo, dizziness. We help many people with vertigo and dizziness. Now, there's a condition called adrenal fatigue. So whomever you are, if you have dizziness, you're moving back and forth, I would have your blood pressure checked sitting and then standing. Your blood pressure should go up from a sitting to a standing position. So to recap what we were talking about, upper neck misalignment, that feeling of motion sickness oftentimes is adrenal fatigue. Recently had a question from somebody who did a liver gallbladder flush, and we talked about this procedure in Dr. Bob's Drugless Guide to Detoxification and Dr. Bob's Drugless Guide to Balancing Female Hormones. And the liver gallbladder flush is a formula that I just learned about along the way that we just suggest that people might do to help stimulate liver gallbladder movement activity, and oftentimes you'll see a response in your colon, some sludge, some sightings you may see in the toilet. It's just a body signal that we know that your body is functioning. Well, this individual felt that it did not really make an impact on their bile. So here's my suggestion to all of you watching me, wherever you might be in the world right now, is the apple. Dr. Bob's ABCs, that half a red apple helps thin bile. That's really important. When you're under stress, stress causes an acid pH in your body. Bile is alkaline. Bile balances stress, as far as physiologically. If your bile is stressed a lot and using up a lot of that acid pH balancing, you could have thick, pasty bile. I wanted to just share that. It's a very important question and a good one, and that information about thinning the bile with apples is important. Dr. Bob, could I take peppermint oil with a medical condition, including any type of hepatitis? Well, first, I want you to know this. Hepatitis is an inflamed liver. Peppermint oil itself helps motivate and stimulate liver gallbladder function, as will any bitter herb, like a radish will do that. I have found some people could have issues with nightshades, like tomatoes, eggplant, green pepper. Green pepper could stimulate liver gallbladder function. I'm not telling you to or not to use the peppermint oil. You know, that is going to be your own discussion for yourself. But I can tell you from my experience, peppermint leaf, peppermint oil, the herb peppermint, is very useful for helping to stimulate liver gallbladder function. Should or shouldn't use with hepatitis C, that's going to be your call. You probably would be better off to eat that half a red apple every day. Go really slow with the peppermint leaf. My name is Dr. Bob DeMaria, and thank you once again for joining me. Ask Dr. Bob.